Hello everyone, my name is Dr. Matthews. I work as a physician in doctor offices and hospitals around the country. Many people suggest about talking about Staphylococcus aureus. People may have heard of Staphylococcus aureus, but do they really know what it is? We have to consider the evolution of this bacterium. We should investigate this bacterium from its first discovered in the early 1880s by a Scottish surgeon named Alexander Augustin. Staphylococcus aureus is a major bacterial human pathogen that causes a wide variety of clinical manifestations. Infections are common both in community-acquired as well as hospital-acquired settings because of the distress with the high rate of post-operative mortality and unwilling to accept death as a likely outcome of surgery. Augustine was an early convert to the value of antisepsis advocated by Joseph Lester. Given the absence of inflammation in the wounds of lesser post-operative patients, Augustine abandoned the contemporary teaching that suppuration was a necessary stage in wound healing and adopted the antiseptic techniques of Lester. Augustine lauded Lester for transforming the future of surgery from hazardous lottery into a safe and soundly based science. Let's head to the lab and check what Staphylococcus aureus looks like under a microscope. Staphylococcus aureus is a gram-positive bacteria. That's why it's purple and its shape is spherical and tend to be arranged in clusters that is described as a grape-like. These organisms can grow up to 10% salt media, and the colonies are often golden or yellow color. They can be found in nasal cavities and mucous membrane, and on the biggest organ of the human body is the skin. They can be found on 30 to 40% on the human, but most of them can be found in medical profession settings, especially in hospitals. They have a non-symbiotic relationship with the host when there is no open wound outside the skin or even inside the body. But if there is an open wound or a cut that is exposed to Staphylococcus aureus, that relationship will be parasitic. They are facultative anaerobes, which means they can proliferate without the presence of oxygen, and they also can ferment mannitol. An MSA test plate is useful. Staphylococcus aureus phylogenetic belongs with the Staphylococcia, closest relative Micrococcia and Salinococci bacteria. They cannot form endospores. They also have many valence factors including lamellin, which is an adherence factor, or protein A that binds to immunoglobulin, which disrupts the optimization and phagocytosis. But it doesn't stop there. With invading and adherence, there's also one that serious damage to cells like alpha-toxin that forms pores in cells or super. Doesn't have to stop there with invading and adherence. There's also one that serious damage to cells like alpha-toxin that forms pores in cells or super antigens like enterotoxin A through G and toxic syndrome toxin. There's still plenty of antibiotics to treat multi-drug resistant bacteria. We can't forget that hospital-related infections are hard to treat, and they are rising, mostly affecting the elderly population that have chronic infections or immunodeficiency. But this can push us to research and discover more antibiotics for future medicines and